Hi everyone, and welcome to my presentation. I'm very honoured to be presenting here today. My name is Yasmin and I'm a PhD student at the Kirby Institute of University of New South Wales in Sydney. I'd like to begin by acknowledging that I'm here today on the land of the Gadigal people and the Eora Nation and pay my respects to the elders both past and present, and acknowledge all Aboriginal and Torres Strait Islanders who are attending this presentation today. So today I will be presenting data collected by a national representative survey in which we estimate the prevalence of blood donation eligibility, people's perceptions of their eligibility, and the main reasons for ineligibility in the Australian population. Estimates of the prevalence of the population eligible to donate blood help to model the likely impact of changes in eligibility criteria, and also to inform targeted population level education recruitment and retention strategies. So by identifying the most common exclusion factors and populations where blood donation eligibility rates are highest, blood collection agencies can target these in education campaigns. Previous studies in the US and Canada and Australia have provided estimates based on epidemiological data, and these estimates range between 45 and 70% of the population. Tarani Lucky and colleagues, they published a study in Transfusion which estimated that in 2012, 62% of 16 to 80-year-olds, or 47% of the population, were eligible to donate blood in Australia. Yet only 5.1% of those eligible gave blood, so clearly there is a large mismatch between the number of people who are eligible to donate blood and the number of people who actually do donate. And since this paper was published, there have been quite a few changes to the eligibility criteria, and so we set out to update this estimate. So the aim of this study was to estimate the prevalence and perceptions of blood donation eligibility in Australia by a representative sample of the Australian population. So to do this, we conducted a cross-sectional national population survey, and this is the first survey ever of its kind to estimate blood donation eligibility. We conducted the survey in November 2001 by a probability-based panel called Life in Australia, which is run by a company called the Social Research Centre. And to be eligible to complete the survey, respondents had to be over the age of 18 and be residing in Australia. So we collected a total of 5,178 completes, and 96.5% of those completes were completed online, and 3.5% of the surveys were completed over the phone. To ensure that the demographic questions were framed adequately to capture gender, sexuality, and diversity of sexual characteristics, we followed the UNSW best practice indicators. 43% of the sample was male, 57% were female, and we also had 23 non-binary, 3 people who use a different term, and 2 of the respondents did not answer this question. 42.9% of the survey sample were recorded male at birth, and 56.8% were recorded female at birth. 1 respondent selected another term, and 1 said that they do not know, and 12 refused to answer. So here we've got the age groups listed. So you'll see here we have we have an older demographic in the survey sample, with 40% of the respondents aged 55 and over. In the survey, we asked questions about attempts to donate blood and their blood donations experience and when they last donated blood. And respondents were categorized according to when their last blood donation took place. These categories are in line with the Lifeblood's definition of donor status. So a current donor is defined as having donated blood within the last 2 years. A lapsed donor has donated blood previously, but more than 2 years ago. And a non-donor is somebody who has never donated blood before. So in our sample, we had 9% were current donors, 36.1% were lapsed donors, and more than half of the sample were non-donors, having never donated blood in Australia before. For 37 of the respondents, we couldn't establish their donor status as they did not provide enough information in their responses. So we calibrated the data to population benchmarks using Gregg weighting, an estimated residential population strata, and National Health Survey estimate strata for age group, educational attainment, household composition, so whether they were a single parent with children, couple with children, etc. Language spoken at home, remoteness, and state or territory of residence. So when we weighted the data, we found that the eligibility rate was 61.9% across all of the genders in the sample, and 66% of the males were eligible and 58.1% of females were eligible. Amongst the 18 to 74-year-olds, which is the ages where a new donor can come forward and donate blood, the eligibility increased to 66.5%, and 72% of males were eligible and 61.6% of females were eligible. I haven't displayed the data here, the weighted data here for the gender diverse populations, as the numbers were too small to infer anything from the data. So of those eligible, only 12% had donated blood within the last 2 years in Australia. 36% of those eligible were lapsed donors, and half of those eligible had never donated blood before. So this demonstrates a very large untapped pool of potentially eligible blood donors in Australia. So here I've listed the most common exclusion factors amongst the survey sample and provided the weighted prevalence rates. Please note that these are based on preliminary analyses only, and also there might be some overlap of these conditions amongst individuals in the sample. So the most common exclusion factor was anemia diagnosis within the last 6 months, with a rate of 9.8%, and the deferral period for this is until the condition is resolved. This was followed by cancer diagnosis within the last 5 years, and the rate of this was 4.6%, and the deferral period for this is 5 years after treatment completion. Pregnancy within the last 9 months was the next most prevalent at 3.4%, and the deferral period for this is 9 months. And ever experienced significant damage to their heart was 2.6%, and this is a permanent deferral. The next most prevalent exclusion factors were stroke, heart failure, significant kidney damage, diabetes with secondary problems, and secondary problems with the eyes or kidneys, hepatitis B infection, all of which leads to a permanent deferral, except for hepatitis B infection if it is an acute infection. And then males who had had male-to-male sex within the last 3 months was 1.8%, and the deferral period for this is 3 months since the last sexual contact. Just this month, in May 2022, the TGA approved an application from Lifeblood to remove the VCJD risk deferral criteria. So until now, anybody who had lived in or visited the UK between 1980 and 1996 for more than 6 months were permanently deferred from donating blood in Australia. Within our survey sample, 6.7% of respondents had lived or visited in the UK within this period. Now, when we equate this to the Australian population, or the over 18 Australian population, this equates to about 1.34 million people, and it also increased the eligibility rate within the survey sample by 5%. In the survey, we asked people questions about whether or not they think they are eligible or ineligible to donate blood, and we compared this to their eligibility result. We found that 70% of the eligible population correctly believe that they are eligible. However, 15% were incorrect in their perception of their eligibility, so they believed that they are not eligible when in fact that they are. And 15% said that they do not know their eligibility status. Now, this is quite concerning because many people who are eligible to donate blood may not be donating because they think they are not eligible, whilst if they knew that they were eligible, they might be encouraged or more motivated to donate blood. Of those ineligible, 50% were correct and believe that they are ineligible, but 31% were incorrect in their perception of eligibility, so they believe that they were eligible to donate blood when in fact they are not, and 19% do not know their eligibility status. So this is also an issue because if they were to show up to donate blood, they would be deferred, and this poses a time on the donors and lifeblood's time and resources. And also receiving a deferral can be a deterrent to future blood donation attempts and negatively impacts on donor return rates, especially amongst first-time donors. Now, there were some limitations to this survey. So, for example, there is some bias in the survey sample, with a larger proportion of females and an older age group. However, we accounted for these by weighting the data. Also, this is not a biobehavioral survey, so we were reliant on self-report, and we were also unable to collect hemoglobin or blood pressure tests, and we also didn't have access to the transfusion transmissible infection testing. We also, due to time limits, we were unable to ask all of the donor questionnaire questions, and also to conduct the interview. So in summary, this study demonstrates that we potentially have a large pool of people eligible to donate blood in Australia, but only a very small minority of those eligible have donated blood recently. The removal of the UK and BCJD risk deferral criteria is very welcome news, and this should significantly increase the donor pool. It also appears that the public's knowledge of blood donation eligibility is very poor, with many people believing that they're not eligible to donate blood when in fact they are eligible. So we need to address this issue through improving public health education and blood donation recruitment marketing campaigns. So here I've listed references to the paper I mentioned at the beginning of this presentation, so where blood donation eligibility estimates have been previously calculated in the US, Canada and Australia. And I'd just like to acknowledge here that the Australian governments fund the Australian Red Cross Lifeblood to provide blood products and services to the Australian community. And also that this work was majority funded under a partnership grant from the Australian National Health and Medical Research Council. And thank you very much for listening to my presentation. Please reach out to me via email if you have any questions or comments.